Hello, dear friends. I am Dr. Banshi Saboo. I am from Chicago, American Diabetic Association. Along with me, Dr. Manoj Chawla and Dr. Amit. We all three are here. A lot of new things which were discussed in this year ADA. Some of the things which are really cutting edge science which was discussed here, and few things I think we should discuss on this platform. So let me talk with Manoj regarding this once in a week Semaglutide, which will be available in our country soon. The strike data. Will you talk about more for that?
Sure. So thanks, Banshi, and thank you. Um, we've seen semaglutide show its data in different indications. You're aware about the flow trial where it showed benefits in the renal. You're again aware about its cardiovascular outcome trial and the benefits there. Now, nobody really has done any data generation in patients with peripheral arterial disease, and we know that peripheral arterial disease continues to be a significant problem in patients with type 2 diabetes. And the only drug actually in the US which is approved for that indication is silastazol. And we know that it has its own limitations and very often can't be even used in patients with heart failure and other contraindications. So STRIDE was the trial for the use of semaglutide in patients with peripheral vascular disease, a positive outcome study which showed improvement in terms of the claudication distance, the distance that the person can walk. It showed improvement in the quality of life. So in favor of semaglutide, that's another indication that they may get as a drug for its benefits in patients with peripheral artery disease. So that was the STRIDE data which was discussed here at ADA Chicago.
And some of the clinical trial centers were from India also. I was part of one of them. I was as a co-investigator because PI was the vascular surgeon for peripheral artery disease. So something first time a GLP-1, which we normally do only for cardiovascular, is being discussed for peripheral artery disease. So Amit, lot of GLP-1 we talked, and then dual had already come in the market. But in this year, we had seen even triple and quadruple. So where you find the future of these molecules which are in combination, GLP, GIP, amylin analog, glucagon antagonist, and even calcitonin, which was also in phase 2 trial. They had shown significant amount of weight loss. But do you think that they will be in real and near future, they will be a molecule for use?
Thank you, Dr. Bansi sir, for asking that question. As you know, we have been observing a shift in the therapy for type 2 diabetes and the obesity over the last few years. And now, what we were discussing few years before, now we are seeing that they are becoming reality. And now they are also coming into clinical use. And I can say for sure that the next decade is going to be of GLP-1 and GIP and glucagon antagonist based therapies only. But the only thing is that now there are concerns. The people, there are still concerns regarding the safety aspect and the safety for the other organs. But right now we know that they are beneficial for the cardiovascular, they are beneficial for the kidney and the even all the other organs. So right now we don't have any red flag, but because they are the new molecules, so we have to be cautious. And this is one area where we are going, which will decide the future of these therapies.
Very true. So, I mean, you rightly said that, as you know, some of the phase 2 trial data has been published here, but we all are worried of their safety part, but they had shown they are quite safe. But one of the biggest advantage of this quadruple, because when GLP and GIP had come in the market, they are not only reducing the weight, but at the same time, muscle mass was also reducing. So, we are worried of sarcopenia. And these are the newer triple and quadruple agonists. They had shown the benefit of preserving the muscle mass, and despite of that, they are losing the weight. So, significant weight loss, which is more of visceral fat loss, even more with the fat loss from liver also. That is what the CagriSema had also shown the data for that. So, and not, reducing the muscle mass. So that's really, very important. We have with us Dr. Purvi Chawla. Please, Purvi, come here. And Purvi, I just want to ask, there was a lot of line. If you have seen, and it was house full, the hall was full, and it was on a very small molecule, and it was a oral GLP-1 and non-peptide, and We all were very excited that, at present we are using peptide, but it is in oral form. So early in the morning you have to take and that. So what the data will you talk about that oral new molecule which will be there available soon?
So fantastic reference to the trial or forglipron. That was the molecule you are referring
Yes.
to, Dr. Banshi sir. And that is one of the small molecule GLP-1 receptor agonists. A really game-changing molecule because it's actually going to help us mitigate a lot of challenges that we are facing with the current oral one. So in Achieve 1, that was the phase 3 data that was presented here, and 40-week study in drug-naive type 2 diabetes patients, where they saw an HbA1c reduction of 1.48%
That was really significant.
and weight loss of up to 7.5%
Yeah.
weight loss, which is quite
So that's
significant.
ideal for Indian patients. We want
Absolutely.
them only to reduce around weight of 7 to 8% with an HbA1c of 1 to 1.5% reduction, and they are using a non-peptide oral tablet which can be taken anytime. You have not to wait for the empty stomach and something like
Exactly.
this. A ideal molecule for Asians is going to come soon.
And you won't believe, sir, but it was really well tolerated as well. The gastrointestinal side effects that we otherwise see with all the other peptide molecules, it was considerably lower, and overall, it was very well tolerated.
And more than 100 people were standing outside the hall
To get
for the trial
the
with
first,
distribution. The first time I had seen the people are standing outside.
absolutely,
Great.
a smashing session.
Exactly, very true.
Let's wind up.
Good. Thank you.
Thank
Bye-bye.
you. Bye bye.